Hello, thank you for inviting us to talk at the ICS 2021 online conference. My name's Claire Riley. I'm a clinical nurse specialist for neurourology at the Royal National Orthopaedic Hospital, London Spinal Cord Injury Centre, Stanmore, UK. Today I'm going to be discussing on behalf of my colleagues Dr. Sarah Knight, Mr. Frank Lee and Rizwan Hamid, patient satisfaction with suprapubic catheters for bladder management in spinal cord injury. I have no affiliations to disclose. Following a spinal cord injury, damage to the innervation of the bladder and sphincters can result in neurogenic lower urinary tract dysfunction. This can lead to problems with the ability to store urine and effectively empty the bladder. The primary aim of managing neurogenic lower urinary tract dysfunction is to protect the upper urinary tract. Secondary management aims to improve patients' quality of life by allowing them to have appropriate bladder emptying and reduce incontinence. Clean intermittent self-catheterisation is the gold standard for bladder emptying, however it is not always achievable for all patients. Suprapubic catheters are preferable to indwelling urethral catheters in order to protect the urethra from further damage. There's been multiple previous studies that have evaluated the clinical outcomes of having a suprapubic catheter. However, the aim of this study was to evaluate the patient's perspective and experience of suprapubic catheters in the management of neurogenic low urinary tract dysfunction secondary to spinal cord injury. This was a prospective study of patients with spinal cord injury who attended the clinical nurse specialist suprapubic catheter change clinic. Patients' demographics, previous bladder management and number of UTIs per year and catheter blockages were recorded. In addition, they were asked to complete a patient global impression of improvement with reference to the insertion of their suprapubic catheter. They were also asked whether they would recommend a suprapubic to a family or friend that was in need of similar care. 50 patients completed the questionnaires, 58% being male, 42% being female, with an average age of patients was 54.4 years, ranging from 18 to 78 years. As you can see from the graph on the left side, the majority of our patients, being 52%, had a cervical spinal cord injury, with 22% being thoracic lesion, and the rest making up a population from lumbar, sacral, cordoequina, and other injuries. On the graph on the right hand side, it shows patients' previous method of bladder emptying, with the majority having an indwelling urethral catheter prior to their insertion of an SBC. We then looked at patients that complained of urinary tract infections and blockages. Only 8% of our patients experienced regular catheter blockages, with 32% experiencing occasional blockages. 22% of the patients had more than 3 urinary tract infections per year. This is shown on the graphs below. The graph below shows the results from the patient global impression of improvement score in relation to whether their suprapubic catheter was an improvement on their previous bladder management. As you can see, 40 out of 50 patients reported a PGI score of 1 or 2. 1 meaning very much better, 2 much better. This shows that most of the patients found a significant improvement on their bladder management since having a suprapubic catheter. We then asked questions about recommendation of a suprapubic catheter if a friend or family was in a similar position. Out of 50 patients, 47 of them were likely or extremely likely to recommend a suprapubic catheter to somebody in need of similar care. In conclusion, this study had shown that despite the complications sometimes associated with suprapubic catheters, such as blocking and urinary tract infections, the majority of patients report that this was an improvement on their previous bladder management and would recommend this to a family or friend in need of similar care. We continue to offer suprapubic catheter insertions to patients who cannot or do not want to perform clean intermittent self-catheterisation. Thank you for taking the time to listen to this talk.